The mental health system is governed by an outdated law, last revised in 1964. The legislation focuses on custodial care of mentally ill persons and is not in accordance with contemporary international human rights standards regarding mental health care. The law is primarily concerned with the treatment of persons with mental illness in psychiatric institutions. It thus neglects the critical need to promote community-based care. It uses derogatory language that perpetuates stigmatization and discrimination by, for example, describing people with mental disorder as persons of unsound mind. A 2008 report by Dr. Sheila Nabanji and others on mental health reforms in Uganda called for radical reforms in the health sector to guide mental treatment.
There's nothing on community care. So there's nothing there on community. And again, this is an area where we need to have this Mental Health Act coming out. So we hope government can take this seriously and do something about making sure that this bill is enacted.
The current act does not provide any legal obligation for employers to hire a certain percentage of employees that are mentally disabled, provisions concerning protection from discrimination at work, dismissal, lower wages, and other incentives for the mentally incapacitated. The ministry is drafting a mental health policy encompassing many positive reforms, including decentralization and integration of mental health services into primary health care. These efforts are, however, undermined by an outdated law.
If you look at the people who are roaming the streets, whether it is in Gulu, whether it is in Arua, whether it's in Mbarara, whether it's where in Kampala, the only place, according to the current Treatment Act of 1964, the only place where you can treat such people involuntarily is Butabika Hospital. And yet in our new bill, the bill that we have actually included all the other government hospitals.
Mental health is underfunded in Uganda, with only 1% of the health expenditure going to the sector. There are 1.83 beds in mental hospitals per every 100,000 people. There are also 1.4 beds in community-based psychiatric inpatient units and 0.4 beds in forensic facilities. This is compounded by a general lack of trained human resources.
We are training general health workers to be able to identify the common conditions and to give some sort of treatment and then refer where necessary and to know where to refer. We are also training more specialized health workers. There are more psychiatrists being trained, psychiatric clinical officers, psychiatric nurses who are being trained, and they are being deployed to health facilities countrywide.
Mental health issues are currently funded through donor aid mainly, which has affected service delivery. Zahra Namuli, NBS Television.